Hello, I'm Dr. Nigel from Ozhean Clinic.
Hi, I'm Dr. Ho from Ozhean Clinic.
So today we have something very special. Yeah, so Dr. Ho have been suffering from this issue for quite some time already. So what is the main issue when you look at him? There's one place that he's not very confident about, right? Have been sometimes, right? So
Yes.
yeah, Dr. Ho basically have some issue with the subsiding of the hairlines, right? So that's why now he's here and I'm trying to help him up. Are you ready for that?
Yes!
But before we're going to introduce a treatment to him, of course, as a medical doctor, we should know what is the main cause that Dr. Ho suffers from. So, a few questions to ask you, Dr. Ho. First thing first, how long have you been suffering from the hair loss issue?
Okay, so mine is actually male pattern baldness, but this is usually mainly genetic lah. I've been having hair loss since I was 20. So my hairline has been receding and receding until today I need help.
So, but in his case wise, I think Dr. Ho is not too bad yet. So that's why there's still a lot of ways that we can help him out. Yeah. So I think Dr. Ho have chosen one of the best way, right? So what is the program that you wish to do?
Okay, we have this Ozhean Signature Hair Meso, which I think is the safest and the most effective treatment for receding hairline. So basically, about 2 to 3 months course, and it's actually injection based, and it's actually made from cytokines. Cytokines are basically growth factors, so it can help to stimulate a lot of baby hair and help existing hair to grow back.
Have you done a trichoscope for yourself?
Nope.
No. So do you know a trichoscope, everyone? Trichoscopy is basically using a magnifier to have a look of the hair condition. So since Dr. Ho have never done trichoscopy before, let us do on him, right? So you can come closer, we will have a look of the hair, right? So you see, let us check on the normal scalp first that we can see from the computer. Yeah, so that's what you will do for all my patients who come for a treatment. We will go for a trichoscopy. So you see, this is a normal hair style that basically Dr. Ho is quite oily in the scalp. But you can see each of the hair follicle, for the healthy one, there is very thick hair. Sometimes you got two hair from one follicle, and this is a healthy area. But can you see the oil is quite is oiliness? So this is very typical for male pattern hair loss. They always tend to be a little bit more oily. But you see, even at the problematic area, it's so oily. Can you see? So that's why it's quite confirmed. This one is the typical male pattern hair loss or androgenic alopecia. The scalp usually is very oily, and you can see the hair is like the distance is very far away, and you can see the hair is not strong, and they're just broken off, and one of the hair follicle only got one hair. It's not like the healthy one, they got 2 or 3. So you see, this is the issue that you can compare even by Dr. Ho himself on the disease area, hair loss area, and on the healthy area. So that's why it's good that Dr. Ho start to do the treatment now, still the early stage. If he delay a little bit later, all this treatment might not help for him, and he indeed need to go for FUE. Yes, hair transplantations. You know, that one is a massive, not a massive, but it's a surgery. So you have to go through some downtime. So for this current mesotherapy, do they have any downtime, Dr. Ho?
Okay, the good thing about this treatment, there's basically 0 downtime. So I'll be able cleanse your forehead, the hair area that needed to be injected, and we can start immediately, and it has minimal swelling and there's no bleeding as well.
So today, what are we going to perform, Dr. Ho?
Ozhean Signature Hair Meso.
Yes, this is a very gold standard technique for those who have early hair loss. Before you're going for all this invasive treatment, we always can do this kind of mesotherapy to reduce or to prolong your time of balding. So that's why, do you like it? Have you done before?
Yes, so far.
Yeah, very good. Come nearer, we have a look of Dr. Ho's hair, right? So how many times you have done, Dr. Ho?
So it's 1/3 of the course, so
1/3 now. 3 times now. So as you can see from Dr. Ho, actually it's quite good. You can see very small tiny hair started to grow already, even though he have done 4 times. All this area are all bald previously. So now not even up to halfway, he already started to have a lot of small tiny hair. So the whole treatment will last around 8 to 10 times. So duration is every 2 weekly you do once, right? We will do some assessment for you first before you do the treatment to see your suitability. And then after 3 months later, around that, we will do the comparison. And most of our patients are happy men like him. So now, are you ready, Dr. Ho? Right? So we're going to start now on the mesotherapy. I have disinfected his whole scalp, right? So most of the time, there are a few ways to do so, but some patients who are afraid of pain. So you might ask me, is it very painful? So yes, it's like some mosquito bite, but if you do not want to feel the pain, most of the time I will do a nerve block over here. Once you do the block, your whole scalp will be numb. But Dr. Ho is a strong man, so he said, I do not want to do any nerve block. Yeah, so that's why we use a vibrator. The function of the vibrator is to divert your attention, so you don't feel that much of pain. But I think he's fine. He have done 4 times already. So we shall start now. Are you ready, Dr. Ho? Right, so we start now. Alright, so we have done the last injections. So how do you feel, Dr. Ho, with my injection technique? Wow, I'm so happy. A doctor praised me for my skill. Yeah, because all of our Dr. here in Ozhean AM are all experienced doctors. So do not need to feel worried of the pain, because we will try to reduce your pain as well. And of course, on the skill is very important. If you can come nearer, what is a good injection point that you can see a lot of protrusions? That one is black. The black means the injection is not too deep and not too superficial, just nice. Then it form a blab over there. So when it form a blab, you slowly diffuse onto the scalp tissue, and that's how you can stimulate your follicle. If you put too deep, you go to the muscle. So if you go to the muscle, you can't really stimulate your hair follicle. All right. So what is the next step, Dr. Ho?
So we'll be doing the LED therapy.
Rejuvenation, right? So LED is basically one of the good steps for hair mesotherapy as well. After hair mesotherapy, few things that you can do for LED. First one is, of course, soothing of the skin, repairing of the skin after the injection. A lot of trauma. The second thing is there are certain wavelengths in the hair meso. Is like, if I'm not mistaken, 600 plus nanometer. It can help in stimulating the hair follicle as well. So that's why it's a dual function for the LED light. All right. So anything else that if you want to know, you can always call to Ozhean AM Clinic, to our number, and we will give you a thorough consultation. Right.